aside from all those issues that Kristen just highlighted, I mean, there was the other one in terms of President Trump planning this on Juneteenth, the celebration of the end of slavery, but also now a lot of health issues surrounding a rally that could stack up nearly 20,000 attendees at the BOK Center in Tulsa. And a lot of doctors aren't too pleased with that. A petition basically sent around here calling on the mayor to cancel the Trump rally. And the doctor behind that petition is joining us now to discuss some of the risks associated with it. Dr. Jabraan Pasha, the internal medicine physician at the University of Oklahoma Medical Center in Tulsa, joins us right now. And Dr. Pasha, I mean, obviously, nobody wants to see a super spreader event go badly, but there are a lot of risks associated with you being a doctor on the ground here. What's your take on why this is not the greatest idea in the middle of a pandemic?
Well, you know, if you look at what's going on right now, before the gathering that's scheduled to happen tomorrow, we're in a position where we're seeing new case increases, unlike we have seen throughout the entire pandemic here in Oklahoma. On Wednesday, Oklahoma saw 250 new cases, which was a record. On Thursday, we saw 450 new cases, which was a new record. And while our numbers relative to some other states like Texas and Florida are lower, it's the rate that is most concerning. And that's before 20,000 people get in arena and maybe 100,000 people descend on the city. And so you can imagine the potential for a super spreader event in downtown Tulsa.
Yeah, especially when we think about, I mean, masks have been one thing when we talk about how you can protect yourself in events like these. We saw protesters wearing masks across the country. I mean, when you look at that, it does seem that this rally is they're not requiring masks. They're going to be encouraging that you wear them. The president himself has not really worn masks in public. When you look at that, though, I mean, is it surprising that wouldn't be more encouraged here when we do have 20,000 people potentially packing into an indoor arena?
Yeah, it is surprising. And we know there are several things that we can do as individuals to decrease the risk of spreading the virus. One is, obsessive hand hygiene, washing our hands and using hand sanitizers. Another thing is social distancing, which may be the most important thing. Keeping your distance from people who are not part of your family, which is going to be basically impossible to do in an arena. And the third thing that we know works is putting a mask on. And if we have a significant number of people who are unwilling to wear a mask during these gatherings, that creates the potential for a significant increase in our cases.
Yeah, what's sad is that a lot of that, I guess, that we have seen more states, just California the most recently, in instituting a mask mandate here, but a lot of it falling across political lines. And I'm just curious to get kind of the reaction to you being the one raising your hand and trying to put up a fight to say, look, this is not what we want here in Tulsa, especially as a doctor who's going to have to deal with the ramifications in actually treating these patients, potentially having people die on your watch. So what has been the reaction to your push to get this rally canceled?
I think the most notable reaction is how the healthcare community has gotten behind this. I posted the link with the letter on Sunday around noon, and by 5 p.m. we had 500 signatures. Now we're approaching 1,000 signatures. And so the healthcare community, those who are educated on the risk of something like this, are fully behind limiting the gathering. And we never asked our mayor to not allow the rally to happen. It's not about the rally. Whether it was a concert or a sporting event, I would have drafted that letter. It was just at least try to prevent it from happening indoors. And although that many people gathering in any situation is not ideal, our hope would be that we could maybe get it to be moved outdoors to try to decrease the risk of spread.
Yeah, and decreasing the risks are exactly what we've been highlighting on this show so far, and for the last week, really, and months, in why it's so important. And right now, this will be one of those cases where we are seeing a large amount of Americans coming together in an area that has seen a rising case count. We'll keep our eyes on it, but good luck out there. Dr. Jabraan Pasha, again, internal medicine physician at the University of Oklahoma Medical Center in Tulsa. Appreciate you taking the time to chat with us.
Thank you. I appreciate you.